You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Hi everyone, this is Tony Dow, and welcome to another episode of Pharmacy, IT, and Me. And as with every episode, we start off this one stating that the intended audience are newcomers to pharmacy informatics. And this week, we want to go over CISOM, so CISOM. CISOM is a new model. It's the model released by HIMSS Analytics, and it stands for Clinically Integrated Supply Outcomes Model. And this is an 8-stage model, which has stage 0 to 7, which provides a strategic pathway to track processes and products used in care, basically supply chain tracking, and how to mobilize this data and create real-world evidence of impact and outcomes in patient populations. So this is not going to be a very detailed episode. I just wanted to bring this up because it is a new model, and we'll go over some of the different stages of the model. So the focus areas of the model is, to achieve automation, clinical integration, predictive data analytics, and governance and leadership. So at stage 0, within stage 0, that's basically you're beginning nothing, right? Like there's no integration of anything yet. So inventory and supply processes are manual. There's no supply chain strategy identified yet for the organization. Once you hit stage 1, this is when basic supply chain processes are established as a business function of the organization. So this is when you start introducing basic supply chain processes, policies, and things like that. You kind of have that structure and have that pathway that you're going to move towards. And then when you get to stage 2, this is when you have inventory tracking and automation. So you also have optimization of supply cost and inventory management. So when you got things in here like, all the inventory and all their costs, all their prices tracked in the system, that's kind of like where stage 2 is at. And when you hit stage 3, this is a little bit more complicated. So that's when supply chain strategy creates visibility of inventory across the organization. So all the things that you've been doing with supply chain up until this point has just to, keep it in the system. But then now you actually bring visibility to where the inventory is going across the organization, across the company, and everything like that. So in stage 3, you also have automation of financial processes that are linked to product procurement. This is all your requisitions, procurement, things like that. And then you also have evidence-informed product standardization. Now, when you get into stage 4, this is when you have integration of supply chain processes into clinical programs. So now your supply chain is actually affecting the actual clinical programs in place. And this is also where you have optimization of inventory management linked to patient care needs. That's important. So at stage 4, this is when all that supply chain processes that you have in place, they start to affect the clinical workflow, the clinical program, and all the patient care. And then when you get into stage 5, it says supply chain processes are automated and integrated to the point of care and at the point of care. There's complete traceability of products and care processes. And this is when automated tracking of adverse events and product recalls can occur. So, when the FDA releases a med watch saying a certain medication needs to be recalled or voluntary recall, something like that, you can actually go back into your supply chain and then pull those quickly and accurately. And then at stage 6, this is when there's transparency across the patient journey of care. There's automated traceability of patient care processes and products. And then the provider team care delivery is linked to individual patient outcomes. You're getting to that point where you can show details and patient outcomes with your supply chain process. And then finally, 7 is the last stage, and this is when it's fully clinically integrated supply chain. This is going to be when you have the precision and personalized healthcare service delivery, and when you have real-world evidence of patient outcomes from traceability of care processes and products. So that was kind of just like a quick overview of all the stages of CISOM or CISOM. And you want to learn more about it, I've also attached a link into our show notes so you can check out the rest of the article and the rest of the model yourselves if you wanted to get a few more details that I may not have gone over today. Alright, if you like our show, please share with your friends, or you can help us out by writing a review on Apple Podcasts or any of your other favorite podcasting services. You can also check us out on social media, on Facebook, Twitter, Instagram, or LinkedIn, and you can also reach out to me at tony@pharmacyitme.com. If you want to network, you can check out the Pharmacist Slack group at pharmacistconnect.com, which is PHARMACISTSCONNECT.com. There's different topic channels, including informatics, and I've met some great colleagues on there, and I look forward to connecting with you as well. Thank you again for listening, and I'll see you on the next episode of Pharmacy, IT, and Me. And remember, technology is a tool, patient care is the goal.